Hello everyone, this is Shad Reyes from SCAI 2024 in Long Beach. I'm really privileged to be with Dr. Azeem Latib, who is the Structural Heart Chairman, track Chairman, as well as late presenter.
Thank you, thanks for having me.
So let's talk about, first of all, the Structural Heart track, which has been really evolving at SCAI for a course of years, but definitely it cannot be any better time than now. So what has been done in the last 1 year, and where do you see this track going forward?
Right. Thank you. Great question. So, I think the structural heart track has really been around trying to make sure that interventionists and structural interventionists here in the US are exposed to the full breadth of structural heart. And so when you think about how the tracks have been organized, there have been late-breaking clinical trials. There's sessions dedicated to looking at the science and evidence, right? There's sessions dedicated to aortic, then mitral, and also lots of clinical cases. What's new this year is tricuspid, because now we have a dedicated tricuspid session, because we have now two FDA-approved devices for the first time in the United States, which makes it very exciting. So when I look forward to next year, I think we're going to see more of the valves, more of the atrioventricular valves. I think tricuspid, there's going to be a lot more interest from colleagues in tricuspid, how to get involved, how to get good outcomes. So I think that will be a little different next year. The other part that I'd like to see a little different next year is more the sort of engagement of the heart team and kind of bringing in interventional imaging much closer, right? One of the differences when you do coronaries versus structural, when you do a coronary intervention, it's just you in the room. Right? It's you, the nurse, the fellow, but there's not a lot of people. When you do a mitral procedure, or you do a tricuspid procedure, or maybe even a complex TAVR, there's you, there's the surgeon, there's the imaging colleague as well. Right. And our imaging colleagues bring so much to the table. They teach us about anatomy, they make sure we have good outcomes, and working together is so important. So I think we'll need to see more of that next year, which is good for SCAI, it's good for all of us, because we get closer with our imaging colleagues too.
So Azeem, what I'm hearing is now part of your committee is you have invasive or structural imaging experts on the panel.
Absolutely. So that's one of the things we're going to try and do a lot next year, is in the committee to try and design these sessions, actually have some of these sessions designed by imaging people, right? And maybe we're not trying to compete with an echo conference. This is not an echo conference. This is trying to just help the interventional cardiologist to get better at imaging, and to also for the young fellows who want to get into this field, to help them realize how important it is to work together, right? Work as a team. Have, like me and my imaging colleague, people often joke is we know each other so well, we sometimes don't even have to talk in the room. He knows exactly what I want. I know, he knows what I'm going to do next. I don't have to say anything. So teaching people to the importance of that.
Yeah, synchrony, very important. And last item I would like to ask, especially from the structural track, any statement or documents kind of the council is working on for structural?
Yeah, I think there are a couple that they're working on. I'm not sure those will be ready for presentation next year, but as those do become available, we'll make sure everybody knows about it. I think the other important thing about next year is also having a lot more case-based sessions. I think that's what colleagues want, right? They want to know how to apply the data or the device to their patient, how to manage a challenging patient. So we're going to try and make a lot more case-based sessions.
Thank you so much. Again, it's an exciting time, tricuspid and beyond. And thanks for all the hard work you do and the council. Watch its videos and others on the SCAI TV. This is Shad Reyes from Long Beach, SCAI Scientific Session 2024. Thank you so much.
Thank you.